Wow, what an excellent response, Raul. I remember when I switched from medical surgery, like Med-Surg nurse, and I did the ER internship, and I became an ER nurse. That was a frightening experience at first because somehow in your mind you develop that if I face an emergency, like I'm the only one there, and that I have to come up with all the answers. That's not the reality. The reality is that when an emergency comes, everybody wants to be involved in that emergency. Like I remember that code blue goes on, you have the whole entire hospital in that room. You actually have to say like, okay, we have enough. We have
Go
enough.
away, go away.
Go away. We have enough people here. So I remember that, Raul, that, when I became an ER nurse and I had my first emergency, like suddenly I have like 2 doctors, a bunch of nurses, experienced nurses, rapid response team there. And of course, at first, I was more like, ooh, okay, let me get back and let the expert kind of do the thing. Yeah. And I watch and learn. But as you become more experienced, then you're more hands-on. You're like, oh, I can do this. I've seen this like 1 time, 10 times, 15, 20 times. So it's very important what Raul is saying, to trust your instincts. If it doesn't look right, it's probably not right. If it doesn't feel right, it's probably not right either. And like Raul said, the most important is A, B, C. The patient's breathing, it has a pulse. Okay, everything else can wait a little bit. Okay,
right.
So
we've got time to think. Yeah. Well, and here I want to talk to people's fears about that. For instance, when I graduated, I went straight into ICU. Like 6 months before I graduated, I had a job in ICU. So I had no experience, no Med-Surg experience, nothing. Wow. Of course, I was terrified. I don't recommend it for everybody, right? I didn't know what I didn't know. So to me, that was normal. And I remember one day, and I drove into work. And when I went to get my assignment, I had a realization. While I got dressed in the morning, while I drove to work, not once did I ask myself, oh, what kind of patient am I going to have? Oh, is it going to be too hard? Oh, my stomach is hurting. Not once. It was the first time. And I said, well, I wonder what a patient I'm going to be getting. And my answer was, whatever it is, I got it. Right? But it took 3 years before I walked in saying, whatever, I got it, right? 3 years. Now, granted, it was ICU, but 3 years. But this is exactly the same for all your new grad nurses, whether you're a year or 2 years out of school. Trust me, you still feel like, what if I miss something? Or what if I do something wrong? What am I going to get? And you stress and you're worried. It's normal. 100% of us feel that way when we start nursing. When you meet that experienced nurse or that experienced preceptor, because that's another thing, right? You're starting off here in the US or anywhere, you're going to get a preceptor that's going to hold your hand. They're your immediate resource to ask questions and to guide you. You're going to have them for a while. And after you don't have a preceptor, you can still ask them. They're still experienced nurses. And then you have your charge nurse. They will be an excellent resource. So you have resources, and that's before you call an emergency. That's for like simple everyday things that you may be unsure of, right? So you have all those resources there. But even if you're a regular Med-Surg, it takes a year, 2 years, maybe even 3 years. That's normal. I have nurses, because I've trained a lot of ICU nurses. I have had nurses who come into the ICU program terrified. They've been working as an ICU nurse for a year, and they're still like, I still feel like I don't know what I'm doing. Normal. And these are nurses that were Med-Surg or ER nurses for 20 years. And yet when they change fields, because that happens to us, anytime we enter a new area, we feel like new grads, right? So being afraid is normal. It's okay. It's okay. You're normal.